Today we are talking about hair fall. Not as a beauty problem, but as a very common Indian problem. Only one thing people see themselves in the mirror is hair fall.
If you have great hair, it also means that you are metabolically healthy.
Is there a genetic component here?
There is a genetic component. Hormones acts differently at the beard level and at the scalp level. Scalp level, it causes shrinking of hair follicles, leading to hair fall.
Anybody having hair fall should get a list of tests to assess their metabolic health.
Fasting triglycerides, GGT, HbA1c.
Whenever body detects that not getting enough calories that are needed to have a sustained energy level, more portion of their hair follicles are destroyed.
Hair is the least important when it comes to
Hair is not needed for survival.
Survival.
Once the follicle is destroyed, there's nothing that the therapies can do. Minoxidil. We have pills, we have sprays. According to the data and evidence, what works the best? Today we are talking about hair fall, not as a beauty problem, but as a very common Indian problem. And before any other symptom can show up, only one thing people see themselves in the mirror is hair fall. And it is one of the most common symptoms for many other problems in the body. Before starting with hair fall or even hair loss, let's begin and understand why is hair important on the body.
hair is not a vestigial organ, right? It's part of the body and it is kept without. So all of us had a lot of fur, evolutionary speaking, and the parts of hair that is present with us right now in modern world is not something which is just so happened. It is very strategically left as a part of evolutionary processes. And the reason why we do have hair at the scalp is because the cranium contains the most important part of your body and it requires a lot of thermoregulation because the brain is functioning at a very rapid pace and it consumes a lot of energy. And it cannot be affected with UV radiation or the cosmic radiation or for that matter as simple as heat for as such. So all of this put together, it is important to have hair on the scalp, right? And it also is important to have good hair on the eyebrows because when you are doing endurance training or for that matter back in the day when you are hunting and gathering stuff and you are on the wild, you are sweating probably and you are not least likely to have time to wipe it off your face. So this acts like a filter. Now the society has brought it down to making that as a signal for good health because if you have great hair, it also means that you are nutritionally well resourced and you are taking care of yourself. And it also means that your hormonal balance is there and you are metabolically healthy. So as much as we don't want to judge anybody, we are constantly judging everybody. And it starts, like it is done in less than 3 seconds. And hair does signal a lot of things because of which I think people are really worried about even if 20 things are falling apart in their health.
Since you said good hair growth is a signal of good health. Overall, it's a signal of your good metabolism, hormones being maintained well, and you're nourishing your body well, having good macro and macronutrients in the body. So, do you declare it's not genetic and only a systemic problem, or is there a genetic component here?
There is a genetic component as well as we understand. There are enzymes. Hormones at the scalp level is really, really weird, at least in my POV, because the hormone that is responsible for your sexual functionality, making your characteristics better on multiple other traits of yours. It could be for men, testosterone makes the voice more bassier. So the testosterone does that at the vocal cord level. It makes the shoulders wide. It makes the sexual functionalities up and running. It makes your mood well. But there is this particular hormone for version of testosterone, which is dihydrotestosterone, acts differently at the beard level and at the scalp level. When I first learned it, long ago, when I was challenged with hair fall myself, and understood that it at the scalp level, it causes miniaturization. which is basically shrinking of hair follicles, and that thereby leading to hair fall. At the beard level, it makes the beard grow very well. And this is all genetically predetermined. That's why people end up having, male pattern baldness very early on in their life. But it is not that if you have these genetic mutations or variations going on at the enzyme which is responsible for this conversion, 5-alpha reductase for that matter. So if you have an aromatase flaw, or if you have a flaw at which these hormones come and bind at the scalp level, not just that is going to dictate how your hair fall or hair presence journey is going to be, right? As you keep talking about epigenetics, even if I am flawed with my genetics, it is what I do, how I keep my body, and how I am, where I am brought up, which environment, what I am putting in my mouth, am I physically active or not, which will enable these genetics to be expressed.
True that. I think most people do give a lot of credit to epigenetics, right? That's why we have so many treatment. People take it as a priority to regrow their hair or even address the hair loss issue. But let's talk about those individuals who have this genetic component, since you were mentioning about it as well. Let's talk about androgenetic alopecia. But again, if there is genetic preponderance as well, predisposition as well in them, what they make out of their epigenetics does matter. How soon a person can have early male pattern baldness is determined by their epigenetics again. So let's talk about how these people who are genetically predetermined can have this symptom of hair fall or hair loss or at a follicular level. What are those epigenetically driven factors? Let's talk about one by one, starting with nutrients, then to hormones.
Right. So apart from the male pattern baldness as well, there is alopecia areata. Many autoimmune conditions also does affect, but that's a different story by itself.
So today we are focusing only on non-scarring baldness.
Yeah, non-scarring baldness, and we will also talk about how certain things are reversible and what is not reversible as well. Most commonly experienced type of baldness or hair fall is male pattern or female pattern as such, and things that usually the hair is the least important when it comes to nutrient distribution or energy preservation. Whenever somebody is under stress in terms of how they are recharging their body physically, mentally, hair is the least to be worried about when it comes to...
Hair is not needed for survival as such.
So for that matter, if most commonly seen thing at our center is B12 deficiency, B9 deficiency, D deficiency, iron deficiency. Iron is fine, but ferritin is low, and hemoglobin is in...
Protein insufficiency.
So micronutrients and macronutrients being deficient, or even for that matter, in the normal range, functionally suboptimal range, can affect the hair loss.
People say this, right? We have heard this multiple times. No, I eat 3 times a day. Yeah. My stomach is full. I'm eating to my appetite, but still I have hair loss. Then why these insufficiencies?
Most common thing, secondary to fatigue, is hair fall. In the past 1 year, what we have seen here at PMX, and when they come to us, they are like, I am all okay at my reports. Until we parse it and say that these are good and these are not. But in their perspective, they got their report and it looks all fine. Very less insignificant ones are highlighted, but I'm still having hair fall.
But those insignificant ones people think they are significant for hair growth.
So it's safe to conclude that nutrition plays a very vital role, and having them in the optimal levels is more crucial. And what are the markers that you usually look up in order to find out the reason why somebody is having hair fall when it comes to nutrition as such?
Also, we see this people are well fed. We were talking about this in one of our previous videos as well. People are well fed. Still cells are starving nutrition. That is because most of the time what they eat are insufficient in the macros and the micros a body needs overall. And one of the top cell that gets influenced the first would be hair and gut. That is why they develop these symptoms, and they are insignificant to them most of the times because it will not affect their looks. But once it starts affecting their looks, then that is when they come to think about how is this related with my other symptoms. Maybe along with their hair fall, they're having loss of energy, not able to perform their endurance activities, things like that. Or sometimes there is intolerance to cold along with hair fall and they're putting on weight, this combination of problem. Or sometimes they have bone pains, back pain and hair fall. So we see these different clusters of combinations. But so they wait till that second or third symptoms come in when the hair fall is not the primary concern.
Until then they manage it.
Until then they manage. Pills, all sorts of pills, biotin and biotin. We have seen this, the gummies everywhere. Use a serum, start a gummy, and you'll have better hair fall. But if you see on the internal level, we see people filling their forms, what goes into their body, onto their body from the beginning of the day till end of the day. We see how much of ultra processed food goes in, how many times a day they feed themselves, how many times their gut and pancreas is overworking to push that extra load of glucose. So describe how change in metabolism affects hair fall. Okay, we've talked about nutrition deficiencies, the top ones we covered. And most of the times, one nutrition deficiency is that people start taking pills. To some extent, they're covered. But once there are cluster of symptoms which signifies much more deeper things like alteration in metabolism or hormones. Let's get to this metabolism. How either insulin resistance or systemic inflammation is affecting hair fall.
Whenever somebody is insulin resistant, there is discrepancy in the way food is being converted into energy, and the energy from food is being harvested and it is being channeled to cells.
Yes.
Right. And there is also chronic inflammation that kicks in because insulin resistance is packaged with high visceral adipose tissue, and that will trigger a cascade of pro-inflammatory cytokine release. And hair follicles do not like that at all because they have a thinking system to themselves. They have a stem cell bulge, and these are very sensitive to changes that are happening at the system level. When you have chronic inflammation and when somebody has got discrepancy in how energy is being harvested, hair is again the least thing that is being preserved as such, right? So people start having symptoms at their hair level, skin level, nail level, because these are connective tissues which are of least significance, and it gets directly attributed to somebody. Combine that with poor genetics, right? Combine that with them having an alpha reductase issue or a stem cell degeneration setting in very early at the hair follicle level. The hair loss gets expedited and they will start having shedding as such.
We have seen this, right? Women having PCOS, have insulin resistance, have androgen dominance, and have hair fall too. And these are the women. We also have seen the shift in SHBG. Whenever insulin is spiking, we also see that sex hormone binding globulin differs and alters the physiology. People think most of the time blood sugar is a diabetes problem alone, but it is also talking to other hormones. It's talking to your hair, skin. We see a lot of changes superficially on the skin, on the neck, on the ankles, and especially the hair as well. Do you think anybody having hair fall should get a list of tests to assess their metabolic health? If so, who are these individuals? Do we need to look at other symptoms along with hair fall to get the test done? Do we have to wait for the second set of symptoms to appear? Or do you warrant an individual to get that metabolic panel done if the first thing they see is the hair loss?
Ideal world situation is to perennially be checked on all the parameters that are vital. But somebody is far away from that. They are having cluster of symptoms, as you mentioned. It is fasting triglycerides, GGT, HbA1c, fasting insulin, fasting blood glucose, and some hormones which gets immediately affected because of having insulin resistance as such. Free testosterone levels, LH. If it is a woman, LH surge happens because of which testosterone goes higher in concentration, and usually PCOS comes with high free testosterone, and that causes hirsutism, and that causes chin acne. That also causes, because of this weird relationship DHT has got with the scalp hair, it causes a lot of shedding, and they have spars, coarse, unmanageable hair, along with everything else that insulin resistance also comes with, right?
There are individuals who say, I got my recent blood test done, I got my preventive check done, my HbA1c is perfect below 5.6, I have no pre-diabetes, no diabetes. Now, do they still need to do their fasting insulin? Should they be bothered about it? Or
we'll set the standards today as we are speaking about the metabolic panel. What we have here is HbA1c of 5.2% or less.
Yes.
Fasting insulin of 5 microunits or less.
Yes.
And fasting blood glucose of 87 milligram per deciliter or less. Fasting triglycerides of less than 100. And GGT of less than 20. What else? Free testosterone in men. It is anywhere between 30 to 3.5 to 4.5. And in women, it is best to keep it between 1.5 to 2.
I think this is where these are the sweet spots. For us to be in the best health, not better health. We want best health. We don't want a population level general medicine, right? Everybody wants peak health these days. Nobody wants to compromise on their travels, on their multitasking. They want to be their best and perform their best. So that is why they want to be in their peak health. But when we look at their blood biomarkers, they are at the population level.
Yeah.
But the demands and outcomes and goals they have are far different from the ranges or normal ranges that are set as a standard for population-based medicine. I think that is the reason why we have redefined these optimal ranges so that they are in their peak metabolic health, their hormones are at peak level, and their energy, mood, hair, everything is on a great place. I think this is the reason why we have set standards at PMX Health to be in the optimal ranges.
And these are all backed up with research,
yes,
right?
Exactly.
This is all evidence-based. We have seen if these things are maintained in the particular range that we have defined, it has yielded great outcomes globally, including the Indian subset of population.
Exactly. And their risk for any kind of chronic disease is pushed far away from them. I think that is the major important thing. And since we are talking about generalized hair fall, coming back to the topic, we talked about how metabolic dysfunction is affecting their hair fall. But there are a set of individuals, even when we test as well, blood biomarkers are okay, micronutrients are okay, except mild insufficiencies, which would not define their major hair fall. But when we dig deeper into their history, we see there is a major stress in the family or something emotional, financial, or a loss of a family member, or a surgery for that matter, intense stress, or have gone through crash diets. How are these things affecting the hair fall?
Hair has got 3 stages, right? As we have our just born to being a child, to being an adolescent, to being an adult, and then becoming a senior, and eventually
like a life cycle of a human. We have a life cycle
of hair as well. There is anagen, catagen, and telogen. Anagen is the growth phase, catagen is figuring out and building phase, and the telogen is the shedding phase. It's all over the internet that it is established, and it is all over the internet that chronic stress causes hair fall. For the matters that we have discussed so far, that if you are under stress, body is least worried about the hair, because it's not part of the absolute survival.
Mm-hmm.
So what happens, as we understand, is that most of the hair strands gets pushed into this phase of telogen in order to facilitate energy and nutrients to other parts of the body, and thereby causing something called as telogen effluvium. And this happens predominantly these days in people who are going on an high protein, low carbohydrate, very low calorie diet, because T3 gets affected and thyroid hormone is very critical when it comes to hair growth and sensing which phase gets started when. Every hair strand has got a life cycle to itself and it has got a timeline to itself. Now that is established, if this anagen is going to be minimized and telogen is going to take over for a particular hair strand is determined by what is happening at the system level. That is also established so far, what we have discussed. But if you are on a chronic stress, if you are going through something and that is affecting your physical, mental well-being, and let's say for that matter, if you are trying to get a six-pack, we see many individuals getting low on carbohydrates
and losing the hair
in the process.
And then losing the sleep over it.
Yeah.
We've seen this, people complaining all the time. It's because hair follicles are very, very thyroid sensitive. And whenever body detects that it is in a kind of starvation mode or not getting enough calories that are needed for a body to have a sustained energy level, the thyroid sensing happens and it drifts. Whenever this drift is happening, that is when we see people's hairs, more portion of their hair follicles enter into telogen phase. And also people need to understand, once the hair follicles enter telogen phase, they're not going to move into anagen phase. So whatever the percentage of hair is left in anagen, that is the only hair that any dermatologist or any physician or any medicine or any therapy is going to work on, can solve for. That is important. There are some individuals, I have also seen this in recent consultations, people coming in, one of them had scarring alopecia and there's nothing that we can do. I want you to define scarring alopecia so that individuals who are stressing more over it can understand how it's affected and what options are there out for them.
It's secondary to some insult caused by most likely inflammatory processes, which is most likely driven through some immune dysregulation.
Yes.
Right? Fungus is a common commensal for the air to be present, and in order to preserve the sebum concentration and make the air, the flow of the air, to preserve sebum in order to get the nutrition right and in order to maintain the natural inclination of the air, fungus is also there. Fungus is an opportunistic being and it is there, sucking out some nutrition and then making its life over there. But let's say somebody has got a fungal infection at the scalp level. Usually these fungus are called after the name Malassezia furfur, and they have excessive flaking, they have excessive irritation, redness, inflammation going on at a particular spot. Either eventually it can lead to a scarring alopecia as well.
Basically, the follicles are exhausted. They're destroyed.
Yeah.
Once the follicle is destroyed, there's nothing that most of the therapies can do or work on. And regrowth is limited.
Because scarring is followed by when it comes to scarring, perifollicular fibrosis happens. Let's say I get a cut in my hand, it heals back with scar, and it is not looking the same as the skin that is next to it, because there is a fibrosis that has gone into it, and there is a lot of collagen redistribution that has happened, which is not familiar to that particular area, the neighborhood. The similar thing happens at the scalp level. It just cements the follicle and prevents nutrients from getting into, and it eventually leads to a shiny patch, which means that all these follicles at a particular spot has gone through extensive scarring.
Let's move towards hair gummies and supplements. Most important, interesting topic for everyone. There are a lot of supplements available in the form of sprays, gummies, etc. I want you to comment importantly on Minoxidil. We have pills, we have sprays. According to the data and evidence, what works the best?
We know this story of Minoxidil coming into picture, right? It was once used to be an antihypertensive. People were taking it for pulmonary arterial hypertension, and suddenly they were seeing hair growth in places that they don't want to. They tested it for it, and then they found out that it causes vascularization, vasodilation and neovascularization also in some cases, and thereby making the hair grow. So
It became a hair.
air lotion and an air product as such. Minoxidil is currently most commonly used topical vasodilator. It increases the circumference of a vessel and thereby pulling in a lot of nutrients. Air loves nutrients, air grows. Very commonly, so everybody wants hair. So far it is established. At the cost of what? Nobody wants to fix their health, go through that process of fixing their
working
health,
on multiple things. If you have to work on 5 things to get beautiful hair, then it's a process, right? It's hard work.
Yeah, it's hard
People
work.
don't want to work hard for hair.
Yeah,
I want shortcuts.
Personally, I think that's why these things, gummies sell out, sprays sell out. But some of these sprays has also I've got your finasteride, dutasteride, this range of aromatase inhibitors.
In our clients, what effects have you been seeing with people who are on finasteride?
It can cause testosterone discrepancies, and it can reduce down pre-testosterone status, and it can cause estradiol to increase.
And people are not bothered about skeletal muscle loss, bone loss, or gaining fat.
I feel if you in parallel work on the things that are making your health fall down and thereby causing hair loss, I feel it is okay to temporarily pause it while you are working on things that are eroding the hair health, and but not at the cost of. So what generally happens is it's let's say I'm using a finasteride 0.5% or 0.1% lotion. It can trickle down at the blood level and cause
systemic
effects. Only in 10 to 20% as far as research is concerned. But I've seen a lot of people having, development of love handles or chest fat in excess because estrogen is proliferative in nature and it loves to grow stuff in inappropriate places.
So basically, there's more chances of developing moobs in men.
Yeah. So while you are working at the fundamentals, if you are taking this as a stopgap solution, I think it is okay.
That is okay. So finally, I think whatever topic we pick and choose at PMX, everything boils down to all 4 or 5 pillars. Exercise, improve your vascular growth, improve that blood supply, take nutrition that covers for all the B vitamins, iron, D, sunlight exposure, sleep well. We want repair to happen at every level: gut, hair, immune system cells, etc., etc. Again, comes down to sleep as well, nutrition, movement, etc. So on top of all of this, if they're still losing hair, then I think they should figure out why. Is it a scarring type, non-scarring type? Reach out to your dermatologist or the physician that you're seeing. Then if it's non-scarring, then focus on your metabolic health, get the right hormones tested, get your right panels tested, and then there's a way forward.
Thank you so much for watching this video in full length. If you feel that it yields value to you or anybody who's experiencing hair loss, please share it to them. Subscribe to PMX Health for more such informative videos.